Hi everyone, my name is Hema and I lead our health and social responsibility work on Google Search. One of the key things that we're doing on search is making high quality information easy to find and accessible to all. In the last year in the US, we've updated our search experience to help people go from knowledge to action. First, with a quick search, you can find information about federal government health programs such as Medicaid and Medicare. Second, it's now easier to see if a healthcare provider might accept private, employer-funded, or government-funded insurance programs. And finally, you can find healthcare providers that have available appointments at your fingertips. Making access to care easier for everyone, especially those who need it the most, is a priority for us. So here are some new and expanded features you'll soon see on Google Search. Millions of people signed up for Medicaid during the pandemic. And at that time, the requirement to re-enroll each year was put on pause. That pause expires on March 31st. That's a big deal, isn't it? Because if people don't re-enroll, they will lose their healthcare coverage. To help support in this transition, we will soon make Medicaid re-enrollment information easier to find on search so people can take the right actions where they live. But what about those who might not have insurance, or who are underinsured, or may have Medicaid but still need to find affordable care? To help in these moments, you'll soon be able to see information for community health centers in the US that offer free or low-cost care. We're focusing on community health centers because we know the access they provide to primary care has an impact. It's been shown to improve chronic conditions, increase the use of preventive services, and decrease ER visits. We also know how important it is when you're searching for healthcare providers that the information you find is accurate, like the clinic's phone number and address. So we've used Duplex, one of our conversational AI technologies, to make voice calls to hundreds of thousands of healthcare providers in the US to verify their information on Google Search. We've also used this technology to verify if providers accept certain Medicaid plans in their state. When making care decisions, it's also important to know when a provider has an open appointment. We've launched a feature last year that shows availability of healthcare appointments on search. I'm happy to share that later this year, we'll expand the network of qualified partners in the US and make it simpler for them to self-onboard. Ultimately, this will make it easier for people to get care faster. Now, besides questions about physical health, people come to search in moments of mental health crisis. In fact, suicide is the leading cause of death among people of all ages globally. For searches about suicide in the US, we already show the 988 Suicide and Crisis Lifeline. We've been surfacing crisis prevention hotlines on search around the world for many years. To expand this work to even more countries and languages, we are now partnering with Throughline, the largest verified network of mental health and crisis helplines in the world. Making high-quality information more accessible for everyone who comes to search and YouTube is a priority. There's always more work to be done, but we hope to make a real difference through our continued focus on information as a determinant of health.